Oh, hi. I'm Raul Santos from the University of São Paulo, Brazil, and I'm going to comment on recent results of the SAFEHEART study that were published at ATVB. The SAFEHEART is the Spanish FH cohort. It's one of the biggest in the world. They have around 4,000 patients there, and 2,700 of them are FH patients, and the controls are their unaffected relatives. The good thing about SAFEHEART is that all patients have molecular diagnosis, so it's really a true FH population. And they just published a paper showing of course, the greater prevalence of cardiovascular disease in aphasia that's been already expected from previous investigations. But they try to describe in this paper the pattern of atherosclerotic cardiovascular disease in FH patients. So they compare the affected FH patients with their non-affected relatives, and they found that those patients with FH have 3 times a greater chance of having atherosclerotic cardiovascular disease. As expected, also there was a greater prevalence of coronary heart disease, but interesting, they also found that FH patients had 2 times a greater chance of having peripheral artery disease. Previously, in our Brazilian cohort, we found that those FH patients have 5 times greater chance of having peripheral artery disease in comparison with normal epidemic patients. We had a greater odds ratio than theirs, and this can be explained by because in our study we also looked for the subclinical disease. We did the ABI to test for subclinical disease, and in SAFEHEART they only had the clinical manifestations. Of interest also, they didn't find actually a greater prevalence of cerebrovascular disease in FH individuals, and this is a little bit in contradiction with some previous studies. But I can say that this is a younger population than the other studies, and we still need more long-term data to see whether FH is associated with higher risk of cerebrovascular disease. The factors associated with atherosclerotic cardiovascular disease in the SAFEHEART were older age, the presence of diabetes, greater BMI, higher Lp(a) levels, and also the presence of hypertension. So this is important because it's not only cholesterol, and the presence of the other risk factors actually accelerate atherosclerosis. And this is also in concordance with our recent paper on the severe FH definition of IES, that we not only use cholesterol levels but also the presence of other risk factors in order to stratify the risk of these patients. And finally, I like to say that this study is very important because it helps us to understand more how atherosclerosis behaves in FH, and the Spanish actually are developing a score using not only cholesterol but also the presence of the other risk factors in order to try to come with some prospective data in order to try to help to find higher risk FH patients, and certainly those higher risk FH patients will be the candidates for more aggressive treatments like the PCSK9 inhibitors. Thank you very much.